of directors that were introduced to you on Friday night, because we would love to talk to you about that opportunity more. This year, we were also able to purchase 2 platforms that helped our communication. So you can see that we, hopefully if you're on our email list, you get our excellent email communications. And our platforms have really helped us to communicate with our donors and become more organized. We have initiated a medical awareness program and have been able to send board of directors to multiple medical conferences, reaching many hundreds of physicians in genetics and orthopedics, and we'd really like to expand this as well. We are in the process, again, of the creation of additional resources, and many of you have signed up for the sessions on Sunday, including the roadmap session, and this is really an opportunity that we have to hear from you about what are the needs and issues that you have so that we can respond to you as a foundation to lead us forward in resource development and research. As Joe just introduced, we have asked a fabulous assortment of physicians and researchers to join our Medical Advisory Council. We have our 2012 conference, which I hope you are enjoying and get a tremendous amount of. We have had multiple successful fundraising events, and we'll go into this a little bit in the panel next, but the Banges are just an excellent example of how you can build awareness and support in small communities that can do amazing, amazing things. One of Canada's initiatives, as their healthcare is a little bit different, is setting forth multidisciplinary clinics so that when you go to a tertiary care center, that there are specialists who know about Loeys-Dietz and the multiple specialties. And what do we have planned for tomorrow? What is our vision? What are our hopes? What are our dreams? We'd like to continue developing relationships with our Medical Advisory Council. We'd like to have expanded and continued medical outreach. As you all know, you go into a doctor's office and they are still learning what Loeys-Dietz syndrome is, so we'd really like to focus in on those key physicians, key organizations that we can really do outreach to educate people about Loeys-Dietz syndrome. We would like to expand the multidisciplinary clinic model. We have an excellent website, but we have outgrown it, and so we would really like to put some fundraising and some IT support behind making the website a great resource to its fuller potential. We are so excited that we see all these little clusters of families cropping up. I think North Carolina is maybe winning this weekend. So many families from North Carolina, but we'd really like to learn how to support people in a local way, more through fundraising events, through events to bring families together in a more regional way. One of our big dreams is staff members to help make the operating, the fundraising, the grant writing, everything that needs to be done to improve that through hiring of staff. One of our big research goals that I think is really key in driving us to find answers to all the questions that you're asking is really to develop a research and imaging registry where we could have a database of information about patients, about their medical conditions, about their imaging, about their mutations, so that we have a resource that when researchers have questions we're able to have a very big pool of applicants to go and ask those questions of. Many people have physicians all at different institutions and many different records, and one of our goals is also to work with some different technology platforms to bring to our constituents a way to consolidate their medical resources or their medical information. So when they go to their multiple physicians, there's an easy way of sharing information and communication between physicians. And we really would like to develop a research strategy plan and funding for moving forward in research. This is going to take some major fundraising efforts, and really our goal for this event is you're going to hear about 3 fabulous events that our constituency puts on in the next session, and we're really trying to find 2 to 3 or plus individuals who will leave conference this year really excited and motivated to possibly consider putting on one of the events we're going to discuss next, or an event that you would be very excited about. So we really struggled over putting this slide together. I can tell you where we are at currently is that we have an operating budget of about $100,000 that allows us to do the medical outreach that we're doing currently, to pay for staff members, to do some travel to support our MAC and board development. But we have really, really big dreams. And I know that you all do too. I know that you all have huge desires for research and to get awareness out. And so we invite you to join us. We are dreaming big that we would really like to move forward in staffing, to move forward in the upgrade of the website, to be able to support local meetings, increase medical outreach and awareness, and the initiation of a research imaging registry. And so after doing budgeting, our goal, and we invite you to help us achieve this goal, is really looking to raise $365,000 to really move forward and dreaming big. So we are dreaming of creating a board of directors, staff, and volunteer team that has diverse skills that they walk in to allow our foundation to really maximize its impact within the medical community, to the lay community, and within our own population. We are dreaming of having significant and worldwide impact on changing the future and those born with LDS today. So we invite you to dream big with us and to join the Loeys-Dietz Syndrome Foundation in moving into the future. What we would like to do is empower you and educate you a little bit about the three major fundraising events that we have supported in the past. And so I would like to invite Megan, who is our communication and design manager, who is going to introduce some of our fabulous, fabulous fundraisers to you.